Hey guys, it's Ali here and welcome back to my YouTube channel. Today's video will be all about the progress from day 1 to day 3, the period which is regarded as the most delicate period after the hair transplant. I'll be posting pictures from each day, and later on I'll be discussing about the precautions that are particular to this important period. So before I start sharing the progress of each day with you guys, I just want to show you guys the picture that I took just a day before surgery of my head, just to give you guys an idea of how much bald area I had before undergoing hair transplant surgery. So guys, as you can see in this picture, I had a very big area of my scalp devoid of hair. So during my first visit to my transplant center, my surgeon told me that he might be able to cover this whole area with the 3000 hair grafts he's going to extract. But in that case, I might not be very satisfied with the results, as he has to place these grafts very far apart from each other to cover this whole big area. So it was agreed upon that he's going to place whole of these 3000 grafts on the front of my head and cover that area of baldness and restore my hairline. And later on, after 1 to 1.5 years, if I am satisfied with my results from the front of my head, I can return back to the clinic and get second procedure done on top of my head. So this picture was taken on day 1 in the morning, and as you can see that the donor area is still covered with dressing and bandage, and the only change in the recipient area is the change in color. It looks more reddish black now. This is because the healing process has started. And if you have a close look at this picture, you might be able to appreciate the extent of swelling I had, particularly on side of my head. So later in the evening on day 1, I visited my transplant center for removal of my dressing from the donor area. So to my surprise, there was only a trace amount of blood when the dressing came out. I did receive my first head wash after transplant on the same day as well. The method they use for the head wash was to sprinkle a bit of saline on the newly transplanted hair, and then they pour more saline all over the head. And they dried up your head with the help of the gauze later on. So the recipient area looks a bit more cleaner today after receiving a head wash last evening. If you have a closer look at the picture, you can appreciate the pinkish color of the scalp. This is all the inflammation that is present, and this is as a result of all the poking it received during the procedure. You can also appreciate the beginning of scab formation process around the hair graft. And again, you can still see all the swelling on the forehead that still persisted on day 2 after the surgery, but it has significantly reduced as compared to it was on the day of surgery. So this is how donor area looks like on day 3. It is quite amazing that this area has dried up pretty quickly and has started to heal already. Now, if we have a closer look, we can also see the small punch marks that were made to extract the hair graft from the donor area. So at a glance, the recipient area looks pretty much similar to as it was on day 2 as well. But when we zoom in, we can appreciate the development of small, soft, whitish scabs over the red scabs. In terms of swelling, you can still see that swelling is still there, and it is slowly and gradually regressing. So having talked about the progress from day 1 to day 3, let's now talk about the pain in this period. So to be honest with you guys, there was no pain sensation at all on day 1. Rather, it was a very weird sensation of having a very heavy head, probably because whole of your scalp was numb because of the local anesthetic that they injected. But on top of this heavy head feeling, the swelling that have developed was causing a bit of pressure symptoms, particularly on the side of the head and in front of the ears. And on top of that, although they put the dressing not very tight to cover the donor area, but still merely its presence only was causing enough discomfort on day 1. But overall, with the painkillers that they gave me, it was fairly manageable. On day 2, when the dressing came off and the swelling subsided a bit, this pressure symptoms reduced a bit, but the heavy head sensation still persisted on day 2 as well. On day 3, this sensation of having heaviness in the head went away totally. But even if I was touching on the side of my head where no surgery was performed, I can still feel a bit of discomfort on the top or on the back of my head. So let's talk about swelling now. So swelling was there from the day of the surgery, and it persisted all the way to day 3, and it did regress a bit slowly and gradually. So the swelling was more profound on forehead and on the side of the head on day 1, and as the time passes till day 3, it regresses down and came on the side of the face and later on the side of the neck as well. So to reduce this swelling, I was advised to do a massage, gentle massage on my face. I'll show you how to do it. I actually put my fingers in the center of the forehead and pressed it gently, and then just coming to the side of the face like this and going from the side of the face to the side of the neck, and just massaging it every 2 to 3 hours, just 1 to 2 times. This, along with sleeping with couple of pillows beneath my head to elevate my head, actually helped a lot in reducing the swelling. So in terms of sleeping, I did not had a very good sleep on the night of a surgery. I actually woke up after 3 to 4 hours of sleep, had to sit in bed for about a half hour or so before going back to sleep. This is because I have a habit of sleeping on side, and with 2 pillows beneath my head to keep my head elevated and a pillow on each side of the neck so I don't move my neck, it was very hard to sleep, especially on day 1. Plus the presence of swelling on the back of the head and even on the back of the neck causes a weird sensation when it comes in contact with the pillow. So it was causing a bit of pressure symptoms as well. But as the day progresses, like on day 2 and then on day 3, I got used to it. So let's now talk about the precautions to take starting from the day of surgery. It is advised that you should stay home and relax at least for a few days after the procedure. And as I've mentioned before, you're not allowed to take any drink, tea or coffee for at least 48 hours till the completion of day 2. And in terms of diet, it is advised that you should take a soft diet with lots of juices and keep yourself hydrated. The soft diet is recommended because the swelling on the face actually makes it very difficult for chewing any hard food. So apart from that, in terms of clothing, you should wear shirts and avoid wearing any t-shirt or anything that comes in contact with your newly transplanted hair. Same goes for the cap as well, and you should refrain from both of these for at least 2 weeks. You're not allowed to lift any weight or do strenuous exercise for 2 weeks again. So it is also advised to protect your newly transplanted hair from harsh sunlight for at least 3 months. So whenever you are going out, you are advised to cover your head. And in terms of covering your head, you should wear surgical cap for at least 2 weeks whenever you are going out or going to the washroom. You should sleep with your head straight and a bit more elevated. In terms of medication, as I have mentioned before, you should complete the course of the medication that consisted of antibiotic and painkiller and the stomach medication for 5 days. I would also like to mention that there are certain differences in practice among different hair transplant centers. For instance, I was not advised to put any Polyfex on daily basis on back of my head or in the donor area, but some transplant center do advise it to do so. But as you can see in the picture as well, without even application of the Polyfex, my donor area healed pretty much well and even early as well. So another thing that's different among these centers are the application or sprinkling of normal saline solution to your recipient area or the transplant area. So some of the centers do recommend it to do it every 2 to 3 hourly starting from day 1 and keep doing it till day 3. But it was not the case with my center. So that's it for today. Thank you for watching my video, guys. I hope you liked it. In the next video, I'll be discussing the progress from day 4 to day 7. And if you like my video, kindly subscribe my channel so you can get updates. And thank you so much. Bye bye.